The Ebola virus, a name that would soon echo across the globe, surfaced quietly in the forests of southeastern Guinea in December 2013. This remote region, with its dense forests and limited infrastructure, was an unlikely epicenter for what would become a global health crisis. A young boy just 2 years old became the first victim of what would become the deadliest Ebola outbreak in history. His tragic death marked the beginning of a chain reaction that would devastate entire communities and challenge the world's ability to respond to such a virulent disease. The virus, previously confined to sporadic outbreaks in Central Africa, found fertile ground in West Africa's interconnected villages and porous borders. These connections, which facilitated trade and travel, also allowed the virus to spread rapidly, moving from village to village with alarming speed. This region, still recovering from years of civil unrest and poverty, was ill-prepared for the onslaught of this deadly disease. The healthcare infrastructure was fragile, with limited resources and personnel to combat such a virulent outbreak. Communities were already struggling with basic needs, and the arrival of Ebola only compounded their suffering. The virus quickly spread from Guinea to neighboring Liberia and Sierra Leone, overwhelming fragile healthcare systems and instilling fear in communities already grappling with hardship. Hospitals and clinics, already under-resourced, were quickly inundated with patients, and healthcare workers found themselves on the front lines of a battle they were ill-equipped to fight. The world watched in horror as the death toll mounted. News reports and images of the suffering and chaos in West Africa brought the crisis into living rooms around the globe, prompting an outpouring of concern and a call to action from the international community. The initial slow response, hampered by a lack of awareness and resources, allowed the virus to gain a foothold. Early efforts to contain the outbreak were stymied by misinformation, fear, and a lack of coordination among local and international health agencies. This delay proved costly, as the virus spread unchecked in the early months of the outbreak. This outbreak, unprecedented in its scale and geographic reach, served as a stark reminder of the interconnectedness of our world and the devastating impact of emerging infectious diseases. It highlighted the need for a coordinated global response to health crises and underscored the importance of investing in healthcare infrastructure and preparedness, particularly in vulnerable regions. The lessons learned from the Ebola outbreak in West Africa continue to inform public health strategies and responses to this day, as the world remains vigilant against the threat of future pandemics. Ebola virus, a hemorrhagic fever virus, spreads through direct contact with bodily fluids of infected individuals. This virus is highly contagious and can be transmitted through various means, making it a significant public health concern. This includes blood, vomit, feces, and even sweat. The virus can enter the body through broken skin or mucous membranes such as the eyes, nose, or mouth. The virus can also be transmitted through contact with contaminated objects such as needles or soiled bedding. Healthcare workers are particularly at risk if they do not use proper protective equipment. Symptoms of Ebola typically appear within 2 to 21 days after exposure. The incubation period can vary, but early detection is crucial for effective management and containment of the virus. They often begin with a sudden onset of fever, headache, muscle pain, and weakness. These initial symptoms are non-specific and can be mistaken for other illnesses, which complicates early diagnosis. As the disease progresses, patients may experience vomiting, diarrhea, abdominal pain, and unexplained bleeding or bruising. These symptoms indicate the virus is spreading and causing more severe damage to the body. The high mortality rate associated with Ebola is attributed to its ability to disrupt multiple organ systems. The virus can cause severe damage to the liver, kidneys, and central nervous system. The virus attacks the body's immune system, leading to a cascade of inflammatory responses that can cause severe internal bleeding, organ failure, and ultimately, death. The body's inability to mount an effective immune response exacerbates the severity of the disease. The lack of effective antiviral treatments and the often limited healthcare infrastructure in affected areas further contributed to the high fatality rate during the West Africa outbreak. The outbreak highlighted the need for better preparedness and response strategies to manage such deadly viruses. Efforts are ongoing to develop vaccines and treatments for Ebola. Researchers are working tirelessly to find solutions that can prevent future outbreaks and save lives. Public health education and community engagement are also critical in controlling the spread of the virus. Informing people about how the virus is transmitted and the importance of early medical intervention can make a significant difference. Global health organizations continue to collaborate to improve surveillance, provide resources, and support affected regions. The fight against Ebola requires a coordinated and sustained effort from the international community. Pause 3S. Amidst the chaos and devastation of the Ebola outbreak, stories of survival emerged, offering a glimmer of hope. These personal accounts highlight the resilience and strength of those who faced the virus head-on. Pause 2S. Interviewer. Can you describe your experience with Ebola? Pause 2S. Survivor. It was a harrowing ordeal. The symptoms were severe and the fear of not making it was overwhelming. But with the support of healthcare workers in my community, I managed to survive. Their dedication and care were crucial in my recovery. Pause 3S. These survivors' stories are a testament to the power of human spirit and community. Their journeys were fraught with fear and uncertainty, but they found strength in the support of those around them. Healthcare workers played a pivotal role, providing not just medical care but also emotional support. Pause 2S. Survivor 2. I remember feeling so isolated, but the healthcare workers were always there, encouraging me to keep fighting. They gave me hope when I had none. Pause 3S. These narratives serve as a reminder of the importance of compassion and solidarity in the face of a crisis. While the battle against Ebola was grueling, the courage and perseverance of survivors and healthcare workers alike shone through the darkness, lighting a path to recovery and hope. Pause 2S. Survivor 3. Every day was a struggle, but knowing that others had survived gave me the strength to keep going. We are stronger together. Beyond the staggering death toll, the Ebola outbreak in West Africa left deep scars on the social fabric of affected communities. The virus did not just claim lives, it disrupted the very essence of daily existence. Families were torn apart, and entire communities were left in disarray. The social impact was profound, as the outbreak created an atmosphere of fear and uncertainty. The virus ripped through families, leaving behind orphans and shattered lives. Children who lost their parents faced an uncertain future, often without the support systems they desperately needed. The fear of contagion led to widespread stigma and discrimination, isolating the sick and their families. This social isolation compounded the emotional and psychological toll on those affected. Traditional burial practices, which often involve close contact with the deceased, fueled the spread of the virus. These rituals, deeply rooted in cultural beliefs, became a significant challenge in controlling the outbreak. Communities struggled to reconcile cultural beliefs with the need for safe burial practices to prevent further infections. The tension between maintaining cultural traditions and adopting new health measures created a complex dynamic. The outbreak also had a devastating impact on healthcare workers. These frontline heroes faced unimaginable risks as they battled the virus day in and day out. Many on the front lines contracted the virus and succumbed to the disease, highlighting the risks they faced and the urgent need for better protective equipment and training. The lack of adequate resources left them vulnerable. Their sacrifice underscored the bravery and commitment of those who risked their lives to save others. Their dedication was a beacon of hope amidst the chaos. The loss of healthcare workers further crippled already fragile health systems, leaving communities even more vulnerable to the virus and other diseases. The healthcare infrastructure, already stretched thin, struggled to cope with the overwhelming demand. The breakdown of trust in healthcare systems, fueled by fear and misinformation, posed a significant challenge to controlling the outbreak. Misinformation spread rapidly, creating confusion and hindering efforts to contain the virus. Rebuilding this trust was crucial for effective response and recovery. The 2014 Ebola outbreak exposed the fragility of healthcare systems in West Africa. Understaffed, underfunded, and ill-equipped to handle a crisis of this magnitude, hospitals and clinics were quickly overwhelmed by the influx of patients. The lack of isolation wards and personal protective equipment, or PPE, put both patients and healthcare workers at risk. Basic medical supplies such as gloves, masks, and gowns were in critically short supply. The shortage of trained healthcare professionals further exacerbated the situation. The outbreak highlighted the critical need for investment in basic healthcare infrastructure, including surveillance systems, laboratory capacity, and infection control measures. The crisis served as a wake-up call, exposing the vulnerabilities of interconnected global health security and the need for preparedness beyond national borders. The Ebola outbreak had far-reaching economic consequences extending beyond the health sector. The epidemic crippled economies, disrupted trade, and exacerbated poverty in already vulnerable regions. Fear of the virus led to travel restrictions, border closures, and a decline in tourism. Businesses were shuttered, markets closed, and agricultural production plummeted as farmers were too afraid to tend their fields. The outbreak also resulted in a significant loss of human capital. The deaths of thousands of people, many of whom were in their prime working years, had a devastating impact on families, communities, and national economies. The economic fallout of the Ebola outbreak served as a stark reminder of the interconnectedness of health and economic security. It highlighted the importance of investing in health systems not only as a moral imperative, but also as a critical component of sustainable development. The unprecedented scale of the Ebola outbreak in West Africa triggered a belated but massive international response. Governments, non-governmental organizations or NGOs and multilateral agencies mobilized resources and expertise to combat the epidemic. The World Health Organization, or WHO, declared the outbreak a public health emergency of international concern, prompting a surge in financial aid, medical supplies, and personnel. Médecins Sans Frontières, known for its work in conflict zones and epidemics, played a critical role in providing medical care and raising awareness about the crisis. Countries around the world sent medical teams, established treatment centers, and provided logistical support. The United States deployed thousands of troops to Liberia to build treatment facilities and train healthcare workers. The European Union, China, Cuba, and numerous other countries contributed to the global effort.